If you wear glasses, you wear contacts, you probably have often thought to yourself, well, would it be nice to get up in the morning and not have to put the glasses up, but the contacts in your eyes? Dr. Steven Spitzer is from LaserView of CNY, and we're going to talk a bit about that, getting laser surgery. We talked just before we went on the air. Refractive is the same as laser? I mean, using that term, is that the same as?
Yeah, refractive surgery is more of an umbrella term, and laser surgery is a part of the refractive surgery.
Okay, we're going to answer some of the questions because I know everybody, you know, think, oh, gee, is this good for me? Or who is a candidate, first of all, to have surgery like this?
Anybody wearing glasses or contact lenses, and then there's certain specifications about your own eye that will either make you a good candidate or less of a candidate. And when consultation with your doctor helps to iron out who's good for the surgery and who shouldn't have it.
Age-wise, is there a line at young to how old?
Usually we like to operate on people older than 21. Is usually the earliest. And by that time the eye is sort of settled and stopped growing. I think most of the people that are getting it are in their 40s probably, but there's still people in their 60s getting it done.
Now when you say in their 40s too, which amazes me, because that's about the age when they start with the reading glasses.
That's right.
Which this doesn't correct, right?
That's correct. This is mostly for distance vision, and we don't have at this point the technology to give you both near vision and distance vision, but that's coming.
Okay, I was going to say, you can't do the monovision, like that's exactly what I'm at right now, but...
Oh, well, you can do monovision. That would mean one eye would be treated and the other eye is not treated, depending on if you're nearsighted or not.
So you could do that?
Absolutely.
Is that half price?
Yeah, exactly.
Just a thought, you know, Doc, on this. All right, now I've had eyes done, and I just cannot believe how easy the procedure is and how quickly it's done. How long does it generally take?
The procedure is very well tolerated by patients, and for laser surgery, both eyes getting done usually takes about 10 minutes. And that, including in that time, is just setting up for, you know, the one eye and then moving on to the next eye. So actual surgery time is probably maybe 2 minutes between the two eyes.
How about recovery? And explain a little bit about that. How long? Do you have to do drops and so forth?
Yeah, you do drops usually for a few weeks after the surgery. Recovery time, certainly physically, you're up right away. Vision can recover within you know, a few minutes after the surgery. You're able to see the clock on the wall. That's one of the things I do with my patients and say, take a look at the clock on the wall. And they're saying, holy smokes, I can read that.
Yeah.
So, but usually, you know, what's typical is you get a little bit of a glassy water vision immediately after surgery, and then with time that settles down and the vision recovers pretty quickly.
I know a lot of folks, we see, you know, price. You know, the price point, you know, well, for only $300 an eye, et cetera, et cetera. Price is not always the gauge you should be going by when it comes to your eyes, I would think.
Most definitely. I don't think when it comes to eye surgery you should be bargain hunting. But, you know, certainly price is a very important thing to people, especially these days. But if you're shopping around, you want to know who the doctor is that you're taking care of, that's taking care of you. You want them to be in town, and you want them to be established in the community. And that's what LaserView of CNY really offers. The doctors here, you know, they've trained here, they practice here, and they live here. And they really take great pride in taking good care of the patients that are part of
And you've got a great center out there in Liverpool where you do all these surgeries, which really makes
state of the art.
What does insurance cover or not cover?
Most insurance doesn't cover this kind of surgery because it's elective surgery. There are maybe a couple that will help, but for the most part, insurance doesn't really cover this.
Okay. All right. You know, but you know, if you have one of those flex plans, you can put money in.
That's correct. That's what most people do.
Which really helps. Okay.
That's right.
There's a number right there. Give them a call. I'll tell you something. I think you would be amazed if you know, even thinking about it. Discuss it with folks at LaserView. They are nice guys and ladies too as well. Thanks, Doc.
Thank you very much.
Good seeing you.
Good to see you. Yeah. Thank you.
How many times everybody uses that line on you?